This conference will now be recorded.
Good morning, students. Today's topic, Chlamydia. This is a special type of bacteria. Okay, according to all standard textbooks, this is the last chapter in your systemic bacteriology. Why this is special? This bacteria exhibit viral as well as bacterial properties. Previously, this was under viruses. Then, after so many researchers, this reclassified into bacteria. Coming to introduction, this is obligate intracellular bacteria. Obligate intracellular bacteria means it can survive only within the cell. It needs some life of living matter for their survival and growth. Okay, this is the characteristic of virus, and this one is small, non-motile. This chlamydia contains three important pathogens. One is Chlamydia trachomatis, second one Chlamydophila pneumoniae, and Chlamydophila PSITTACI. Okay, all these are major human pathogens. Causes trachoma, LGV, Lymphogranuloma Venereum, Conjunctivitis, and cicatrization. These chlamydial organisms causes infections in birds and other animals also. Next, coming to classification. Family Chlamydiaceae previously contained single genus Chlamydia. Then recently they added another genus Chlamydophila. Chlamydia contain single important human pathogenic species, that is Chlamydia trachomatis, and Chlamydophila contain two important human pathogens. One is Chlamydophila PSITTACI and second one is Chlamydophila pneumonia. So these bacteria previous names, under the viruses there are two names. PLT agent means cytotoxic lymphogranuloma trachoma agent, and the second name is TRIC organism, TRIC, trachoma inclusion conjunctivitis causing organisms. Okay, these two are previous names of chlamydia. Next, chlamydia is bacteria, not at all virus. This is very important point. Okay, by this chlamydia exhibit so many major viral properties, but at the same time this exhibit bacterial properties also. But this is bacteria, not virus. So, what viral properties exhibited by chlamydia are? So, before going to viral properties of chlamydia, one important point here is these chlamydial organisms lack the ability to produce their own ATP. So, for their ATP, they will depend on host cell. That's why they are called energy parasites. Okay. So, coming to viral properties of chlamydia. This is obligate intracellular parasites. So, first of all, What is virus? So we see the definition of virus. Viruses are small intracellular organisms. Means they are very small. Okay, measured in nanometers. So what is the measurement unit of bacteria? Microns or micrometers. But for viruses, we will measure in nanometers, nm. So same, chlamydia also in size it is in nanometers. Oblique is intracellular parasite. And second important property is cannot be grown on artificial media. If we see all the bacteria, all will grow on artificial media. Please mute your mic. Some disturbances cannot be grown with artificial media like red agar, chocolate agar, nucleic acid. It means some cell cultures, some living thing. Okay. Next, see third point, can grow only in cell lines, embryonic egg, or animals. Okay. All these are the major properties, major characteristics exhibited by viruses. Okay, these three properties are important viral properties, but here chlamydia also exhibit all these properties. Next, another one, this chlamydia is filterable. Why filterable means what is the pore size of normal bacterial filters? That is 0.22 microns or micrometer. Okay, so this is size is in nanometers. Okay, we already discussed. So small enough to pass through the bacterial filters. Okay, next coming to the another important point, this chlamydia produce intracytoplasmic inclusions. Okay, so what is inclusion body? Okay, you all will be see all these definitions, inclusion bodies, virus definition, and these cell cultures, tissue cultures, animals, embryonic egg in your next chapter, general properties of virus. Okay, so here intracytoplasmic inclusions. What is inclusion? First of all, inclusion body means these are the organism specific globular masses. Please remember, organism specific means if it is virus, viral specific. If it is bacteria, here it is bacteria, bacterial specific globular masses formed in the host cell. Okay, formed in the host cell, but organism specific. If they formed in cytoplasm, they are called intracytoplasmic inclusions. If they form in nucleus, they are called intranuclear inclusions. Okay, these are the different viral properties exhibited by chlamydia. Next, what are the bacterial properties exhibited by chlamydia? See, these possess both DNA and RNA. Okay, this is bacterial property. We see the virus, viruses possess either DNA or RNA. That's why we have two groups: DNA viruses, RNA viruses. Okay, and then it having gram-negative cell wall. Okay, but poorly stained, this gram-negative cell wall contain less amount of peptidoglycan for chlamydia. And third one, multiply by binary fission and contains prokaryotic 70S ribosomes. Last point and very important bacterial property, this chlamydial group of organisms showing susceptibility to a wide range of antibiotics. Okay, that's why they declassified this chlamydial group under bacteria. So next, coming to the morphology. Here, morphology also different for this chlamydia. Okay, here we have two morphological forms. One is elementary body and Second one is reticulate body. Two morphological forms. If we see the remaining all bacteria, morphology we are studying like this: gram negative, gram positive, or sporulated, non-sporulated, capsulated, non-capsulated, motile, non-motile, like this. But here morphology also different to this chlamydia. Two forms. One is elementary body. This is extracellular form of chlamydia. EE, small tip here. Elementary body always extracellular. Okay, you can see outside the cell. It can survive outside the cell. That is called elementary body. And this is the infectious form. Please remember, this elementary body is the infectious form of chlamydia. Okay, next, metabolically inactive. Contain rigid cell wall, tough cell wall. If we see the size, 200 to 300 nanometers. Almost size is similar to pox virus. Okay, nanometers in size. Okay, and it contains equal amount of DNA and RNA. This is here only important feature of this elementary body is this is infectious form. Next, second morphological form, reticulate body. Okay, reticulate body always intracellular form. Okay, it is present always inside the cell. And another important characteristic here is this is the replicating form and metabolically active form. Okay, if we see the elementary body, that is only infectious form. Okay, but metabolically inactive and not replicating form. But here reticulate body or replicating form. Okay, small tip: reticulate body, replicating form. This is important point in this reticulate body. Next, metabolically active but contain fragile cell wall. Okay, larger in size compared to elementary body. Size is 500 to 1000 nanometers. Okay, RNA in this reticulate form, RNA content is more than DNA. Okay, this is about morphological forms of chlamydia: elementary body, reticulate body. Next, coming to the life cycle. Okay, so we already discussed what is the infectious form here. Elementary body, EB is the infectious form. Okay, after infection means after entry into the host, this elementary body attaches to the surface of susceptible host cell. Okay, see here, after entry, see this picture, see epithelial cell, appropriate susceptible epithelial cells attaches and then enter inside into the cell. Okay, elementary body. But after entry, within 12 hours, it has to be converted into reticulate body. By we already discussed, elementary body only infectious form. Okay, metabolically inactive. So for their metabolism and reproduction has to be converted into reticulate body. Then here this reticulate body increases in size and start division. So each one is converted into like this within 24 hours. At this stage, it is called inclusion. Okay, inside the cell, inclusion. See, always reticulate body present inside the cell only. So then after within 48 hours, these inclusion body, these inclusion inside the inclusion contains so many reticulate bodies. Reticulate bodies converted into elementary bodies. Then after reaching the maximum mass, the wall will lysis and releases the elementary body into outside. Okay. Then this elementary body attack new fresh cell, new uninfected cell, and cause infection. Again, cycle will repeat. Okay, this is the life cycle of Chlamydia. Okay, all these are what I am telling. All these are general properties common for all chlamydial group of organisms. Okay, next coming to antigenic structure. Here, this chlamydia possesses three types of antigen: group-specific antigen, species-specific protein antigen, and serotype. Serotyping, serotyping specific MOMP, major outer membrane protein antigens. These three are the important antigens. So, first, if we see the genus-specific antigen, it is nothing but lipopolysaccharide. Okay, one of the content of gram negative cell wall, that is lipopolysaccharide. Okay, it is used for the detection of genus-specific antibodies by complement fixation test. And this LPS, lipopolysaccharide, plays a major role in pathogenesis. How? By induction of tumor necrosis factor alpha and other pro-inflammatory cytokines, leading to scarring and fibrosis. Next one, species-specific protein antigen. Okay, this is present on the envelope surface of cell. Okay, so based on these protein antigen, we can speciate uh, into chlamydial genus. Okay, then another one, serotype specific antigens. Okay, I already told these are the major outer membrane proteins, MOMP. These based on this MOMP, each species is divided into several, typed into several serotypes. Okay, this serotyping is typed based on the microimmunofluorescence test to detect the serotype specific antibodies. Next, coming to the cultural characters. Cultural characteristics. We already discussed this chlamydia does not grow on artificial media like bread agar, meconchi agar. This needs some live or cells. Okay, so if we see the culture methods: animal inoculation, yolk sac inoculation, and tissue cultures. So, in animal inoculation, mice is the choice of animal. Different routes are intracerebral, intranasal, and intraperitoneal. These are the different routes of inoculation. After 10 days of incubation, we can see the morphological forms of chlamydia smears from infected tissue. Okay, this is about animal inoculation. Next, second one, yolk sac inoculation. Okay, embryonated egg contains four chambers. One is chorioallantoic membrane, second one is allantoic cavity, third one is amniotic cavity, and the fourth compartment is yolk sac. This is innermost compartment. Okay, usually this embryonated egg is used mainly for the growth of virus isolation. Okay, this yolk sac inoculation will give the growth of chlamydia here. Next, gold standard, and now we are using this method, tissue culture. Okay, in tissue culture also, McCoy cells are the commonly using cells, and other cells, cell lines are mouse fibroblast cell lines, HeLa 229, and monkey kidney cells. Coming to Chlamydophila pneumoniae, gives good growth on Hep2 or monkey kidney cells. So organisms can be detected by staining for inclusions or elementary bodies. Okay, next coming to the pathogenesis. We already discussed in the introduction. It contains three major species. Okay, first one is Chlamydia trachomatis. It causes trachoma eye infection. Lymphogranuloma venereum. Major, this is LGV is STD, sexually transmitted disease. These two are very, very important for you as 4 marks. Chlamydia trachomatis causing ocular, urogenital and neonatal infections. If we see the serotyping, we already discussed about this serotyping in antigenic structure. Okay, based on the antigenic structure of major outer membrane protein, this is divided into 18 serotypes. Okay, serotypes A, B, BA, and C are causes ocular diseases, mean trachoma. Okay, then serotype D to K are responsible for oculogenital diseases. Then serotype L1, L2, L3 are positive agents of sexually transmitted disease, especially LGV, Lymphogranuloma Venereum. Next, trachoma. It is a chronic keratoconjunctivitis. Is the leading cause of preventable infectious blindness. You see the world, right? This trachoma is the leading cause of preventable infectious blindness. Okay, serotypes responsible for this trachoma are A, B, BA, and C. Okay, C, mode of infection, mode of transmission is two types: direct, indirect. Direct by contaminated fingers and vomits, and indirect by flies and other clothes. See, different modes of transmission: contaminated fingers and vomits, and by flies. Okay. Next, in acute stage of trachoma, follicular conjunctivitis and papillary hyperplasia, we can see. Okay, so these infected follicles rupture and to leave a shallow pits termed as Herbert's pits. See, these are the Herbert pits. Follicle infectious follicles rupture and leave the shallow pits called Herbert's pits. This black color shallows. Okay. Then cornea also get infected, leads to keratitis. This happen in acute infection of acute stage of trachoma. This one is picture of keratoconjunctivitis. Next stage. Okay, chronic late stage. Major feature in the trachoma of late stage is cicatrization. Okay, what is cicatrization? Contraction of fibrous tissue at the infected site is called cicatrization. Okay, so if we see the latter stages, late stage, recurrent infection leads to conjunctival scarring or cicatrization. Mainly involved sites are scleroconjunctival junction or on palpebral conjunctiva. Okay, these two are the commonly affected sites. Next, we can see the pernus. What is pernus? Pernus means usually conjunctiva is C. This is avascular. Usually this is avascular, but in case of this trachoma, it is invasinated by fine blood vessels. Okay, this conjunctiva is usually, this one is usually avascular. but invaginated by cornea. This cornea is avascular but invaginated by fine blood vessels. This condition is called fundus. Very important. Next, another characteristic, another clinical feature is entropion. What is entropion? Folding of eyelash inward. Okay, inward direction. See, usually lower eyelash. 90% of cases lower eyelash will inward. Right? See, this is the entropion, folding of eyelash inside towards the reverse direction. So because of this entropion, what happened? This upper lid rub over the conjunctiva rapidly, it leads to conjunctival irritation, and see here, repeated rubbing of cornea may lead to opacity and conjunctival irritation. So this ultimately, if untreated, leads to impaired vision or blindness. Okay, this is about late stage of trachoma. Okay, what are the different features of this late stage? First one is cicatrization. Next one is fundus formation. Next one is entropy. Next, genital infections caused by Chlamydia trachomatis. Here, serotypes are D to K, responsible for these genital infections. Among all, important is this Chlamydia trachomatis is the most common causative agent of non-gonococcal urethritis. Usually, urethritis is caused by bacteria, Neisseria gonorrhoeae. Okay, so we have another type of urethritis, that is non-gonococcal urethritis. Means urethritis caused by other than gonococcal. In that list, first most common causative agent is this Chlamydia trachomatis. We see the symptoms: mucopurulent discharge, dysuria, and urethral irritation. Okay. And other infections are post-gonococcal urethritis, epididymitis, and proctitis. And another important syndrome caused by trachoma is Chlamydia trachomatis is Reiter's syndrome. This Reiter's syndrome in triad means three conditions. Triad of three conditions. One is conjunctivitis. Second one is urethritis in males, or cervicitis in females. This is second condition. Conjunctivitis, urethritis, or cervicitis. Third one is arthritis. Okay, this triad of three conditions collectively called Reiter's syndrome. Sometimes we can able to identify the mucocutaneous lesions also. Next, in addition, in females, this genital chlamydiasis cause pelvic inflammatory diseases, infertility, ectopic pregnancy, premature deliveries, postpartum fever, and perinatal morbidity. All these are the different complications in females because of this Chlamydia trachomatis. Next, another type of infection is inclusion conjunctivitis. Okay, serotypes D to K are responsible for this inclusion conjunctivitis. Okay, in this important is ophthalmia neonatorum. Okay, or also called inclusion Venereum. Okay, so this ophthalmia neonatorum is common in newborn babies. Okay, it develops when the infant is infected in the birth passage. Then symptoms appear between 5 to 12 days after birth. Okay, this is usually self-limiting, but in high incidences we can see microfundus formation and scars. Okay. This is preventable by local application of antibiotics. See, this is the picture of ophthalmia neonatorum. Okay. This condition is common in newborn babies. Next, same inclusion conjunctivitis in adults called swimming pool conjunctivitis. It is an acute follicular conjunctivitis occurs following swimming. Mainly occurs following swimming in public swimming pools. That water in that public swimming pools may contaminated with genital secretions of infected patients. Infected with this Chlamydia trachomatis, mainly LGV, Lymphogranuloma Venereum. Okay, clear? Next, third one is infant pneumonia. Okay, this Chlamydia trachomatis causes interstitial type of pneumonia. It develops within 3 weeks to 3 months after the birth. Infection can also spread from conjunctiva to pharynx via the nasolacrimal duct. Okay, this interstitial pneumonia also causes otitis media, medullary infection. Next, the important one is Lymphogranuloma Venereum. Serotype L1, L2, L3 are responsible for this LGV. Okay, LGV is an invasive, systemic, sexually transmitted disease. Invasive means having spreading capacity. Invasive one and sexually transmitted disease. Incubation period is 3 days to 3 weeks. Okay, we see the first stage, we can observe painless papule, ulcer or vesicle develops on the penis or vulva in females. See, these are the ulcers of LGV in male. Next, coming to second stage, this is the main crucial stage of LGV. Here, this infection, I already told, this is invasive one, so it spreads to regional lymph nodes. Here, regional lymph nodes are inguinal lymph nodes. Okay, they enlarge, tender, and soft, called buboes. Then, after a few days, buboes may break down and discharge the fluid into the outside externally as a chronic fistula. In this stage, we can see the systemic symptoms like fever, headache, and myalgia. See, these are the buboes. Tender, red, swollen lymph nodes. These are the pictures from patient of LGV. See, here also. They rupture inside. Okay. Next, third stage. This stage is very late. If untreated, second stage leads to third stage. Occurs in untreated cases, especially in women and homosexual men. Okay, what happened here? Important feature in third stage is elephantiasis of the vulva or scrotum occur because of the impaired lymphatic drainage. Third stage important point is here is elephantiasis of the vulva or scrotum. So this is about Chlamydia trachomatis. Next, another two species, minor, only small minor species are Chlamydophila PSITTACI. Okay, this is the primary pathogen of parrots and other citizen birds. Okay, causing psittacosis. Infection is psittacosis, but it causes infection in humans also. Okay, reservoirs here are pet birds like parrots, macaws, and poultry birds like turkeys and ducks. Next, mode of transmission by inhalation of aerosols. Okay, from avian nasal discharges or infectious avian fecal or feather dust. These are the different modes of transmission. Next, direct contact with infected birds also leads to the transmission. Here, no person-to-person transmission, only through inhalation of aerosols. Coming to clinical manifestations, incubation period is 5 to 19 days. Incubation period is 5 to 19 days. If you see the symptoms, common symptoms are respiratory symptoms. The respiratory manifestation starts with mild flu-like influenza to pattern pneumonia. Okay, it starts with mild influenza, flu-like influenza. Then it leads to pattern pneumonia, later stages. Then we can see septicemia also. This septicemia later leads to meningoencephalitis, endocarditis, pericarditis, arthritis, and gastrointestinal symptoms. Okay. And third important clinical symptom here is typhoid-like syndrome. Means we can observe high fever and hepatosplenomegaly, and we can see the spots on the patient's skin. Okay, like rose spots in typhoid fever, we can see the spots called header spots. Okay, header spots. Okay, these three are the different clinical symptoms of psittacosis: respiratory manifestations, respiratory symptoms, then septicemia, typhoid-like syndrome. Next, another pathogen is Chlamydophila pneumoniae. This is exclusively human pathogen. Okay, it transmitted from person to person by inhalational route. Okay, it causes atypical pneumonia. This is also interstitial type of pneumonia. Symptoms are common symptoms: fever, non-productive cough. And we can see the upper respiratory tract involvement in this here. We can see the pharyngitis and sinusitis also. Okay, Chlamydophila pneumonia causes, this is exclusively human pathogen, causes interstitial type of pneumonia, and with common general symptoms like fever, non-productive cough. Then we can observe here pharyngitis and sinusitis. Okay, this is about Chlamydophila pneumonia. Next, here small important point, atherosclerosis. Okay, there is a strong evidence of association between Chlamydophila pneumoniae and atherosclerosis of coronary and other arteries. This is autoimmune disease. So, what is autoimmunity? Immunity against self-antigens. See here what happened. Antibodies to outer membrane protein of Chlamydophila pneumoniae. So, antibodies produced against outer membrane protein of, species-specific antigen, outer membrane protein of Chlamydophila pneumoniae may cross-react with human protein. Okay, they will react with human protein, means maybe some antigenic sharing is there. That's why antibodies produced against this Chlamydophila pneumoniae can cross-react with human proteins and resulting in an autoimmune reaction. Okay, this point also very important. They cause exacerbations of bronchial asthma and COPD. COPD means chronic obstructive pulmonary diseases. Chronic obstructive pulmonary disease. Okay, this is about Chlamydophila pneumoniae. Okay. Next, laboratory diagnosis. Specimen collection is very important here, because scrapings or swabs from infected sites are preferable. Okay, but this is intracellular organism, so the sample must contain cells. Okay, this point is very important. So if there is no cells, we cannot isolate any organism, any morphological form from the specimen. Okay, that's why must contain cells in any sample regarding this chlamydial group. Different samples are urethral swabs for non-gonococcal urethritis, endocervical swabs for cervicitis, conjunctival swabs for ocular infections. For upper conjunctival swab is preferable for trachoma, and lower conjunctival swab is preferable for ophthalmia neonatorum. Then nasopharyngeal aspirates and respiratory secretions for pneumonia. Okay, we aspirate for LGD. Okay, we aspirate from vivo means inflamed inguinal lymph nodes is called vivos. Next, microscopy. So gram staining, it is gram -1, but we already discussed it is poorly stained because contain less amount of small amount of lipopolysaccharide. Then other stains are Castaneda, Pecovillo, and Giemsa. Next, inclusion bodies can be detected in cytoplasm. Okay, so for inclusion bodies, Lugol's iodine stain is preferable only for Chlamydia trachomatis. Okay, because these inclusion bodies of Chlamydia trachomatis contain glycogen matrix, so they will well stained with Lugol's iodine. See, these are the inclusion bodies. We already discussed. This is host cell. This is nucleus. This is inclusion body, intracytoplasmic inclusion body formed by Chlamydia trachomatis. Next, direct immunofluorescence test. It is used for the direct detection of inclusion bodies in clinical material. It is mainly used for the direct detection of inclusion bodies. Okay, particularly from the genital infections. Next, the enzyme immunoassay also is available for antigen detection. It detect by enzyme immunoassay we can detect group specific antigen, that is lipopolysaccharide antigen. Next, coming to the culture, we already discussed in the under cultural characteristics. Okay, chlamydia cannot be cultivated in artificial media, but if we see the methods, embryonic egg and animal inoculation methods are also no longer in use. Nowadays, we are not using those two methods. Okay, gold standard here is cell line cultures. Okay, different cell lines are McCoy, Hella 229, monkey kidney cells, buffalo cells, baby hamster monkey kidney cells, all. Next, amplification techniques. Nucleic acid amplification technique also available. PCR, polymerase chain reaction, ligase chain reaction, transcription mediated amplification, and STA, stand replacement assay. These are the different amplification techniques available for the diagnosis of chlamydial infection. Next, serology, antibody detection. Okay, by using lipopolysaccharide antigen, we can detect the antibodies against this LPS antigen by complement fixation test. ELISA also for the detection of LPS antibodies. And another important microimmunofluorescence. This is used for the species and serotype specific major outer membrane protein antigen detection. Okay, coming to treatment, Chlamydia trachomatis. For Chlamydia trachomatis, drug of choice is azithromycin. Okay, we can use doxycycline, tetracycline, erythromycin, or ofloxacin. Okay, for neonatal infections, erythromycin is the drug of choice. In addition to this erythromycin oral intake, we have to suggest the topical ointments, that is nothing but erythromycin can be used in the addition. Okay, next for psittacosis, tetracycline is the drug of choice. For pneumonia, tetracycline or erythromycin are the drugs of choice. Okay, this is about treatment. Okay, Shall I summarize? Okay, just first. So contain chlamydia contains three important human pathogens. One is chlamydia trachomatis. It causes trachoma. Another eye infections like inclusion conjunctivitis, then lymphogranuloma venereum. So we see in this, for you important is trachoma and lymphogranuloma venereum. Then next, another species, Chlamydophila PSITTACI, causative agent of psittacosis. This is the primary pathogen of birds, then and also causes infection in humans. That is called psittacosis. In psittacosis, major common symptoms are respiratory symptoms, then typhoid-like fever and septicemia, we can see. Then Chlamydophila pneumonia causes interstitial type of pneumonia. Okay, this is about chlamydia. Trachoma and lymphogranuloma, very important